Hello, I'm Wally Haas. I'm the Executive Director of Transform Rockford and your host for Rockford on the Record. My guest today is Joan Lodge from Rosecrance. Before we I introduce Joan a little bit more or let Joan talk about herself, this is going to be the fourth episode that we videoed about mental health issues in our community. We previously did Jason Holcomb from the Region 1 Planning Council. We did Mary Trujillo from the City of Rockford. We did Dr. Alex Stignaro Green from the UIC College of Medicine, all about issues pertaining to mental health and the extension of the mental health sales tax, which will be on the November 5th ballot. So my background a little bit, people who know me, I was at the newspaper for 40 years, the last 19 as editorial page editor, opinion editor. And in the course of my career, I spent a lot of time writing editorials about mental health issues. So this is near and dear to my heart. I think one of the last editorials I wrote was about the sales tax and the impact it could have on our community. So as that is the background, I just want to get that out there. We're going to have a discussion now. Joan is an expert in this field, but Joan, before we start talking about mental health, give us a brief bio of yourself.
Yeah. First of all, thanks, Wally, for having me. I really appreciate it. This brings me joy, actually, to be here today and talk to you. So a little bit about me. I'm Joan Lodge. I'm a licensed clinical social worker. I graduated from Aurora University in 1991 with my master's in social work, and 3 days later, I started my first job, my first day of career in helping people at the Janet Waddell Center, and worked under Mariana Body and Frank Ware, and did that for until Rosecrance merged, actually, with Janet Waddell Center in 2011. And the reason that is Phil Eaton and Frank Ware, both CEOs at the time, of Phil of Rosecrance, obviously, and Frank Ware of Janet Waddell Center. They really thought there was this missing puzzle piece, right? Because Rosecrance was experts in the field of substance use, and Janet Waddell Center was experts in mental health. But what we found was many of our clients that we were serving, individuals that we were serving, had combinations, right? Combinations of comorbidity of things together. And so it actually was our mantra when we merged together was that we would be better together. And today I believe that is so true, because now what we have done over the last, since we merged, was become this comprehensive behavioral health center, no longer these silos. And have been privileged, I guess, to be able to continue to be part of the leadership team, provide clinical guidance, mentoring for students, for interns, and had different roles in doing that. Right now, my role is to be grant management administrator and community liaison, which allows me the opportunity to do things like this with you today, Wally. And so it just continue to thrive in the organization so we can continue to prove our mission and help the community.
You mentioned Frank Ware and Phil Eaton, who I consider legends in this field. Frank, of course, left us too soon, but he was a pioneer in the mental health field, and he was missed greatly. And Phil has done so much to keep the ball rolling, not just with mental health, but also with substance abuse. He did a wonderful job at Rosecrance for the years that he served there. So appreciate you bringing them up. Mm-hmm. So, Rosecrance, you had mentioned the combination, the substance abuse and the mental health. You offer a wide array of services. Just touch on some of those.
Sure. We really pride ourselves in providing care across the lifespan. What that means is bigs and littles and families. So kids as ages 4. Because we also believe in early intervention and early screening. So we have behavioral health student assistant professionals within the school system here in RPS 205. And then we also provide a full array of crisis services. And in addition to inpatient residential for substance use disorder, IOP, outpatient, and again, going back to those crisis intervention services, really working on this full crisis continuum. It's been a kind of a work in progress because a lot's happened in the nation and within our state. You know, they rolled out 988, which is that national lifeline phone number. Instead of 911, when you have a behavioral health crisis, you call 988. So we're working with the state to have mobile crisis response teams actually go out to those individuals that need some of that additional support. And we're partnering with individuals that have lived experience, because that's incredible value for a person who's scared and doesn't really understand what potentially might be happening with them, and then have someone that says, you know, I do understand. I get where you're coming from. Let me tell you a little bit about my story and what we can do to help facilitate your recovery. So I'm really excited about that. And with our struggling behavioral health workforce, individuals with lived experience really play a part in providing direct care. So specific to the funding, Rosecrance is incredibly grateful for, we have several opportunities and programs that are partially funded from the Mental Health Board. One is what we call access to care, and that was specifically targeted at getting individuals in our front door to get them assessed, and also psychiatric evaluations and treatment for individuals with serious mental illness and serious emotional disorder. Because we live in Winnebago County, and the Rosecrance Aware Center, where most of this programming is done, finding psychiatry is tough. You know, we had many psychiatrists that aged out of the system. You know, they retired, and just trying to build up that behavioral workforce to be able to meet the needs and have that level of expertise that Rosecrance really prides ourselves on. And then, of course, psychiatry and nursing staff at our 24/7 crisis residential facility has been paramount. Because legendary, and this was another reason why Phil and Frank came together, is because back in the day, a lot of organizations, grassroots effort organizations, relied on grant and aid. Well, those dwindled up. And then we moved to what we call like this fee-for-service model. It's very much like when you go to the doctor, right? You go to the doctor, you're seen, he submits a claim or a bill, and they get reimbursed. Well, the reimbursement rates are subpar and not able to really help sustain without some additional funding. And so we built together those resources, again, to be together. But the Mental Health Board has also helped allow us to increase wages for staff and really bring on board-certified child psychiatrists. That's like unheard of, right? And reduce some of those, and reduce those wait times from like 45 days to 30 days, and within our crisis residential facility, within 24 hours, being able to be seen, so we can reduce individuals from being in the hospital. I mean, that's really the goal, right?
Well, you talked about access. Access to services is so important. And this is not, mental health issues are not something that you can call your doctor and then go in to see him 6 months later.
Yeah.
When you're calling for help, you need help now.
Yes.
So how does Rosecrance step in and help those kind of individuals?
Yeah, that's a great question. So there's a couple avenues. Obviously, you can call 391-1000, and then we have a live person that will get you we'll do a screening, get you to the right person, and that would be our triage center. Additionally, again, calling 988, where you have somebody to help. And if they can't resolve that, then our mobile crisis response teams are dispatched. We're also trying to get the co-responder program is, we aren't the grantee for that, but we provide the behavioral health experts and the clinical team that goes out and pairs with the officers for that program. And so when individuals maybe call 911 the first time, they're told once they respond by CCRT staff, hey, we're here to help you. They'll do follow-ups for 3 months at a time, for 3 months, just to make sure that they get connected to care. And they're encouraged to call CCRT directly to help. They're also given those resources for 988. So just in terms of getting a client, what you said, an individual, an immediate response, because they're hurting, right?
Right.
Other ways to do that is we have a living room program that's actually embedded with our in our Rosecrance Mulberry location downtown, and that allows kind of a really safe, comfortable environment to talk to a peer. The stigma is still a big, huge thing. People don't wake up in the morning and say, "Hey, I'm going to go over to Rosecrance and talk about and get help for my mental health problem or my substance use problem." It's usually you've hit rock bottom. Maybe you've been court ordered. Maybe your loved one is suffering as a result of your, mental illness or your addiction. And so providing these least restrictive options for clients just is more welcoming.
Now, there's a lot to that we can unpack here. So, how many clients does Rosecrance serve?
Last year, we served over 54,000 individuals. Yeah, that would be throughout our network of programs that we provide care for, because of over 60 different locations.
Right. So that's statewide. That's not just Winnebago County.
Right. It's Wisconsin and Iowa and in Illinois.
Okay. So 54,000 individuals, substance abuse and mental health issues, challenges. So, and then, we talk a lot about access to care. So what programs have been created thanks to the extra funding that you've received through the mental health sales tax?
Yeah. I think one of I think we're most proud of and has been so uniquely important is to have a medical suite at our Rosecrance Ware location. A medical suite that is staffed with registered nurses, nurse managers, certified medical assistants. Some of that is for lack of a better word, kind of fluff. I mean, there isn't a reimbursement code for those, but it's just good care. So every individual that's going to be seen by the psychiatrist gets a complete review of systems, because what we also find is that our clients really don't take that great care of themselves, right? They have some physical issues. They may have some underlying blood pressure issues that really go undetected unless you're getting regular screenings. So we do this complete review of systems. We are that conduit between the psychiatrist as well. On an average, every quarter, which would be 3 months, the medical suite responds to over 1,000 phone calls from clients, just about questions that they might have. I need a refill or consultation. We also do an incredible amount of long-acting injections to help promote long-lasting recovery. So the nursing positions and the psychiatry positions have been key. Last year, 20 staff were funded through the Access to Care for the Mental Health Board. We also have another program that is funded through the Mental Health Board that specifically targets our priority population of our community, the low-income individuals that maybe need detox. And so this allows, again, priority access for those individuals if they call and they need to get into treatment, providing them within, the goal is less than 3 days.
Now, you mentioned, the funding, and there's an accountability piece to it, too. You have to show that you're doing well with that money that you're getting from the mental health board.
Of course, and everything should be accountable based, right? Just like, my job or your job. We have regular supervision, we have metrics that we need to meet. And we have to be accountable not only to the board, but we have to be accountable to the community. Like, what are you doing with these funding, right? And so the outcomes have metrics that you need to meet. What's interesting also about the board is what they do is they include demographic information on every single person that you serve. And why is that important? Because we want to make sure that we're meeting and serving the entire county. And so we tag how many individuals from particular zip codes. And that's important to make sure we focus on potential underserved communities that might not have any services available to them. And so they're not maybe utilizing them. I mean, I was at a funeral a couple weeks ago and went by Seward, and I'm like, Seward's in Winnebago County. You know, when you think about 1 in 5 people are going to have a mental health disorder or a substance use disorder, there's probably somebody there that probably needs something.
Yeah. Now, that's 1 in 5 diagnosed. We don't know how many folks
for sure.
never reach out for help. And that number could be even larger. Is that right?
Mm-hmm. Yeah. Absolutely.
So,
absolutely.
So, we could flood you with data. I mean, we could have all kinds of, but, the key is we're dealing with human beings, and you mentioned life experiences. Is there any particular story there that you would like to share with us that you've heard from a client of Rosecrance that really touched your heart?
Yeah, I appreciate that. And again, it's clients having to believe that they can recover and having that hope. And then and in a clinical perspective, empowering clients, to be that cheerleader. And then having them realize that they have potential. The clients that we serve have potential. And then encourage them. We have clients now that have graduated and have been through recovery that have gone back to school to get their what we call certified recovery support specialist. And then they can join our workforce. And then when I go and I see them in the community, we have a client council, and I run that, and the clients just share how much that means to them to be able to give back and share their story. And if you think about it, it's not like a new concept, right? Why have I done what I've done for 33 years? Because it's important to me, and I value it, and gives me purpose. Why wouldn't that be the same for someone else? Right?
Very good. Now, I heard from Stepping Stones the other day that many of their clients are children, are under the age of 18. How important it is to help these children early on, so they don't, so that these issues do not fester and get worse as they age.
Right. I think where we saw that the need the most was when COVID hit and we had the pandemic. And children, all of us were kind of forced to, hunker down and stay at home. And so children didn't have these outlets. Many children didn't get to experience homecoming or prom or graduation, right? And so there was a lot of anxiety, a lot of depression that ensued while the pandemic and the lockdown, but also when you re-enter the kids back in the school, because a lot of social skills were missed, right? And so one of the things that Rosecrance has really done to kind of combat that is to embed student assistant professionals within the school system. And what the schools have reported is improved levels of their ability to function and just cope, and as well as reduced levels of absenteeism. So kids are going to school.
Wonderful. Mm-hmm. So, one of the criticisms about the Mental Health Board is that they seem to give a lot of money to Rosecrance. Now, my answer to that would be, well, Rosecrance is the biggest and serves the most clients overall. They should get a pretty good share of the funding. What would your response be?
Yeah, I'm really actually glad that you brought that up today, Wally, because there is a little, I don't know if it's resentment, discontent sometimes.
Jealousy?
Yeah, whatever that might look like for someone. But because we get mentioned a lot. But again, as you speak of, we are the largest comprehensive behavioral health system in the Midwest. So why? And we're considered experts, right? One of our strategies in our strategic plan is to be best in class. It might sound a little cliche, but I can assure you it is not, because you always have to be an expert in what you do. Because if you dabble in a little bit and dabble in that, you're really not a master, right? And with that being said, we can't do it all, nor do we want to, right? But we want to be at the table to help figure out a solution. And we have done that, and where we have partnered give you a couple examples. We partnered with the Mental Health Board funding with the YMCA, with Big Brothers Big Sisters, to pair our behavioral health. Okay, what's your population that you're looking for? What is your need that you're looking for? Okay, we'll recruit, we'll train, and we will help by placing a behavioral health clinician within your program and your agency to help those things. We also, Rosecrance also wrote a lot of letters of support for other providers to get funding and to support them. One of them that really resonates with me was Marshmallow's Hope, who recently just had their open house, right?
Yep.
We wrote a letter of support for them to receive some funding and award, and we are now currently doing referrals for individuals in mobile crisis response as a step down because they have an intensive outpatient program for like post-hospitalization and things. We don't have that. So let's work together.
What would be on your wish list if there were a program or anything out there that would extend, really further the mission of Rosecrance? What would be on your wish list?
Wow, that's a good one. I think would be for people in the community that if they feel like they have purpose, if they feel like they want to give back, to find a place to work for Rosecrance and have a lifelong career for that. We're growing programs every day, but we need people that have passion. We have a robust intern program. I'm supervising an intern right now for a social work program. And I think just continuing to build that and build our bench. Because as you know, CEO of Phil Eaton retired. Now we have Dr. Dave Gomel, who's wonderful. But sooner or later, our bench is going to, retire
Right.
and things like that. And we just really need to bring up and groom new leadership.
Now, you had mentioned earlier before the camera started rolling a link with Transform Rockford
Yeah.
and a quote from the mayor. Would you like to repeat that now?
I'm
Now
going
that
to
we're
read
rolling?
it, though.
Okay, thank you.
So I just had some experience with Transform Rockford with your predecessor, David Sidney, and actually being a part of some strategic planning for Transform Rockford because Transform Rockford, as I understand it, and please correct me if I'm wrong, was created after Forbes magazine, I believe, called us the most miserable city to live
Yes.
in. And so, getting back to your point with Mayor McNamara, this was his response. We need every person in every organization to fight for our community together. Please find a way to get involved. Talk to neighbors. Encourage your employer to join the effort. We can achieve great things when we work together.
Amen. So actually, everything we've talked about reminds me of a quote, of actually something that Father Keim from Holy Family said during his sermon last week, is that he was referring to Harry Bosch, the fictional detective that in the novels and in the Amazon Prime TV series, I think it's Amazon Prime, whatever, but the TV series, and he said, his favorite Bosch line was, "Everybody counts or nobody counts." And that's kind of what we're talking about here when we're dealing with folks who have challenges like this. They all count. They all have value in our community, and our purpose is to help them realize what their value and realize their potential.
Absolutely.
So as we go forward in this effort, the mental health sales tax extension is on the November 5th ballot. If for some reason that funding dried up, what would you do? There'd be no way you could absorb these programs without that, is there?
No. And we might not be able to provide the community with the robust, medical services and the medical suite and the nursing staff and psychiatry staff at our 24/7 locations. It would be devastating. We would have to figure it out because that's what you do, or potentially close even programs. But we're a big entity. I would be more concerned for programs that aren't as large and aren't as robust. So then, that would be a sad day.
Yeah. One of the things I appreciate about the way this tax has been administered, Region 1 Planning Council puts out this impact report. I wish that all our taxing entities put out a similar report, and so we could see where our money was going. But this document, this booklet here, shows where the money is going. So I really applaud Region 1 for being able to do this so that the taxpayers know that their money is being well spent in programs like at Rosecrance, Stepping Stones, Crusader. There are programs all across the county. Rosecrance just happens to be the biggest and, in my opinion, the best in doing this work. So final thoughts.
Well, I think to that piece, with regards to the impact report, again, there's an accountability piece to the organizations to also educate the community about what we're doing. There's a communications work group that worked on sending the message about, hey, these funds and these services, and this is how many people that we served. Mental Health Board last year served over 6,000 people with these funds. And I think it was 167 behavioral health workforce individuals were hired because of this funding. Our goal with that and organizations that are funded to share this message is to really rewrite the narrative for our community. Because our community has some deep-rooted issues with, poverty, crime, and there's this transformation happening in some of the infrastructure, right? And we have the Embassy Suites, state-of-the-art hotel, right? South Main corridor is getting a new facelift and exciting. I mean, 20 years ago, that was not the place that you would, take downtown at nighttime, right? And so I think that's part of rewriting the narrative too, to really position Rockford, Winnebago County as being a good place to work or a good place to live and a great place to live and raise a family. And that's what this funding has also demonstrated and shared, because we can make it beautiful on the outside, but if the wellness of your community is suffering and challenged, it's not going to keep up. And so both have to happen.
Yes, these are issues that are very important to our community, and you're going to continue to hear and see videos about mental health issues with other guests in here. Joan, thank you very much for being here. Is there anything that we didn't touch on that you want to add to?
I just really grateful to have the opportunity. I could really just stay here and talk to you all day about it, Wally, because it's really near and dear to my heart. And thanks.
No, I appreciate your being on the program today, and I hope we get a lot of viewers that click on this, because I think this information is important, and especially when you go to the polls November 5th, or if you're early voting, if you're getting ready to cast your ballot, just remember that the mental health sales tax extension is on the ballot. It's a half a cent. It's not a lot of money out of your pocket, but the value of this is just immeasurable. So thank you again, Joan. Hey, thank you for watching today. I'm Wally Haas. Thank you, and have a good day.